Welcome back to our channel. Today we're diving into a landmark study that changed the way we approach diabetic nephropathy, particularly in type 1 diabetes. We're talking about the 1993 collaborative study group Captopril Trial. This study looked at whether the ACE inhibitor captopril could slow the progression of kidney damage in diabetic nephropathy. Let's explore the findings and their implications for treatment. Untreated diabetic nephropathy often leads to end-stage renal disease within about 10 years after the onset of proteinuria. Patients with proteinuria are at a much higher risk of all-cause mortality. Early and aggressive treatment, especially of concurrent hypertension, is crucial to slowing kidney damage. Understanding the progression and management of diabetic nephropathy is essential for improving patient outcomes and quality of life. The CSG Captopril Trial was a multi-center, randomized, double-blind, placebo-controlled study involving 409 patients with type 1 diabetes and nephropathy. Participants were assigned to either captopril, 25 milligrams 3 times daily, or a placebo, with a median follow-up of 3 years. This rigorous study design ensured that the results were robust and reliable, providing valuable insights into the management of diabetic nephropathy. The primary outcome of the trial demonstrated a slower rate of creatinine doubling in the captopril group, 12.1%, compared to the placebo group, 21.3%. The number needed to treat was 11, meaning that treating 11 patients with captopril could prevent 1 instance of creatinine doubling. Additionally, captopril reduced the combined risk of death, dialysis, or kidney transplant. The benefit was particularly pronounced in patients with worse baseline kidney function, highlighting the importance of early intervention. The American Diabetes Association and Kidney Disease Outcomes Quality Initiative recommend ACE inhibitors or angiotensin receptor blockers for patients with diabetes and chronic kidney disease, particularly those with albuminuria or hypertension. ACE inhibitors are particularly effective in slowing the progression of kidney disease in patients with type 1 diabetes and significant proteinuria. These guidelines underscore the importance of incorporating these medications into treatment plans for eligible patients. The trial included adults aged 18 to 49 years with type 1 diabetes for at least 7 years, diabetic retinopathy, and significant proteinuria. Patients had varying degrees of renal dysfunction but no prior use of ACE inhibitors or calcium channel blockers. The primary endpoint was the doubling of serum creatinine, a marker of worsening kidney function. The trial also monitored secondary outcomes like the need for dialysis, kidney transplantation, and mortality. The CSG Captopril trial provided strong evidence for the use of ACE inhibitors in patients with type 1 diabetes and nephropathy. By slowing the progression of kidney disease, captopril and similar medications can help delay the onset of end-stage renal disease and improve patient outcomes. This study underscores the importance of early and aggressive intervention in managing diabetic nephropathy. Thank you for joining us in this deep dive into diabetic kidney disease management. If you found this video helpful, please like, subscribe, and hit the notification bell for more updates on the latest in diabetes care and nephrology. Stay healthy and informed.